Hello and welcome to this week's edition of NHIS in a Week. In the headlines, NHI partners Healthcare Federation of Ghana to begin medical entrepreneurship. NHI board chair signs up to enroll 1,000 children under the 1,000 for Health project recently launched in the Ashanti region. And also this month of October is Breast Cancer Awareness Month. We take a look at symptoms of breast cancer. To our first story, the National Health Insurance Authority is expected to facilitate a process by which health practitioners can venture into medical entrepreneurship. The initiative, championed by the Healthcare Federation of Ghana, highlights the process of training and nurturing of doctors, nurses and other health professionals to acquire entrepreneurship skills through government support.
Yeah, so today basically we are here to introduce ourselves to the biggest buyer in there. We are all healthcare, as you can see. We are healthcare businessmen, but on the private sector. Yeah. We want to see, we work with our biggest customer in the industry, which is the NHI. And then we also with the government, being a government agency, to see how we can work together, because we all have one mandate to serve the people of Ghana. Whether we don't have private Ghanaians and public Ghanaians, we have Ghanaians. And we all have a mandate under the Sustainable Development Goal 3 and the universal health coverage to make sure that we increase access to healthcare to as many people in the country as possible. So that's what we came in here to introduce ourselves to and see how we can work together.
Dr. Bernard Okoboy, Chief Executive Officer of the National Health Insurance Authority, said government acknowledged the need to partner with private sector to drive the economy and that the partnership will be a great boost that will widen avenues for job creation in the country.
We as an entity are very much interested in government's objective of universal health care. And we know that in every sector area of the government, you need private partners to reach perfection levels in almost every sector, in agriculture, in health, in sports, in tourism. And I also have a lot of faith in the Ghanaian health worker, that our quality is very high. So if we get entrepreneurs who take advantage of the quality we have, then we create that kind of industry that can give opportunities to everybody.
Health insurance, any just some can say my pa Healthcare Federation of Ghana, or initiative no more by any just some can say my yen say by the year 2030. I was if we are safe and then no. Krobia was a Ghana ekahono. When your crana was say 80% of your people omutimia access to healthcare. Access and also hospitals are basic and I said the nipa bekono ekahobi. Enti sa initiative we are bay and as innovation with their bay. A papa yen, a year and system kase. The entire cancer and say health facilities be brave and uncall for SEC. Omo health insurance, yedema omo. Most of them are not ewo chrome cities. Ebubo home emwa obi wo hard to reach areas are. This of car and sana wako hospital and also the financial burden many pakro. In this program eba na se yetumi de konkrase e man kofo etimi kosho mapomudia ebeboa ebebre anytime make say any system kese.
Dr. Kofi Nkansa, Chief Executive Officer of the National Entrepreneurship and Innovation Program, said one area that had received less attention was the health sector and lauded the move to address the situation.
And so, NHI Healthcare Federation and National Health Insurance Authority, Ebekambo Muna Yedi Jumawe, said the money when I buy the P. Agu, Aquanso, I have any idea private sector. Now, Ebebwa Amayanya Yuma, Amagana for.
Moving on, the CEO of the nation's foremost hospital, Kolebu Teaching Hospital, Dr. Opokuwari Ampoma, has commended the CEO of the National Health Insurance Authority, Dr. Okoboy, for his innovative and transformative ideas, which gives the NHIS a more visible and particularly impactful outlook. Dr. Opokuwari said this when he led a delegation on a working visit to the NHIA boss at his office in Accra. The board chair of the NHIA, Dr. Ernest Kwaku, is set to register 1,000 kids in the Ashanti region onto the NHIS. The acting director of the Corporate Affairs Directorate sat down with him to throw more light on his ambitions for the project.
The Ashanti regional team, when their executive management charged them to find innovative, they came up with this idea of Project 1000K, and that is to register 1,000 children onto the scheme per sponsor. So this is going to be the registration fee. The children already don't pay premium, so the registration fee is going to be paid by the individual sponsors. And though officially we launched it yesterday, I can tell you that the people who are knocking on our door, the people who wanted to be even the first to sign onto the T-shirt, the symbolic T-shirt, to be the first. Right. Of course, we had to allow our regional minister who was doing the launch to be the first, and the coordinating council has also signed. So they are already taking 2,000, and there are many more. And it's been so overwhelming.
The Ewutu Senya East District of the National Health Insurance Authority organized its maiden stakeholders engagement. The theme for the occasion was inclusion in the NHIS benefit package in achieving universal health care coverage. The forum sought to educate stakeholders on various programs and policies of the NHIA, foster a good working relationship among stakeholders, ensure stakeholder satisfaction and empowerment, and create a platform and opportunity for them to discuss their concerns. The Client Services Manager from NHI's Corporate Affairs Directorate, who represented the Acting Director of Corporate Affairs, Mrs. Ruth Kukwa Intumi Coleman, in addressing the stakeholders, reaffirmed the authority's commitment and support to stakeholders in achieving the universal health coverage and excellent client relations. The Regional Director, in delivering the keynote address, outlined the CEO's 5 vision and the new policies rolled out by management of the authority. Also in the Boku district, the Boku district office of the authority also held a community derby in the Benaba community. The purpose of the derby was to apprise the community on the need to link their Ghana card to the NHIS card and educate them on the ease of renewal using the mobile renewal service. Benaba is one of the biggest community in the Boku West district, with majority of the populace active on the NHIS. So the month of October is Breast Cancer Awareness Month. So this week on Health Tip, we take a look at the signs and symptoms of breast cancer. Next is NHIS tidbits.
Did you know that renewal of NHIS membership for persons aged 70 years and above is instant and can now access healthcare immediately? However, members who are not aged 70 years or have not renewed their membership for over 3 months will serve a 1-month waiting period before they can access healthcare on NHIS. NHIS, your access to healthcare.
This is how we draw the curtains on this week's edition of NHIS in a Week. For more stories, kindly visit our website on www.nhis.gov.gh and subscribe to our YouTube channel and all our social media platforms. Thanks for watching.